We'll get started here in just a moment. I'd like to thank everybody for joining us today for South Dakota Project First Line's office hours. This is for the month of April 2023. Our office hours are a time to come together and get some education from our Project First Line materials and resources that are available to you to utilize within your facilities, and then to share questions that you may have, discuss ongoing concerns or areas of interest for infection control. Today we have with me Sherry Fast and myself, Jess Sanko. We are out at the Sadaho conference, so coming to you from a different location than normal today, but we will go ahead and get it going on our presentation. So for those of you who don't know, Project First Line is an initiative with the CDC. It's to share infection prevention education with the healthcare workers across the state of South Dakota. We collaborate with the South Dakota Department of Health, and we are through the South Dakota Foundation for Medical Care. As I mentioned before, we have a lot of resources available to you today. We are going to discuss one of them like we do each month. The discussions that we have today come from the posters that are shown here. Those are all available on our website, which we will show you at the end of the presentation. There also are videos, interactive resources, all kinds of things that you can utilize for your facility to share with staff to gain knowledge in infection control and to really look for different perspectives on infection control practices and education. So first thing we're going to talk about is that germs can live in water and wet surfaces. So where is the risk in this? Tap water is one of them. It's safe to drink, but it's not sterile. There are always some germs in tap water. Most of the times, the germs in tap water aren't a problem for healthy people, but they can cause illnesses in patients that have very weak immune systems. The germs in water can spread to surfaces and people and essentially cause harm. If medical instruments and equipment, such as devices or central lines, your pulse ox, your blood pressure cuffs, get wet, that's when that bacteria can grow. When those devices are used, that bacteria can then get into a patient's body or blood, and that's when that infection can be caused. So there are some germs that we like to talk about that live in water. Pseudomonas and Legionella are two of them. And I'm going to let Sherry say the other two because I will slaughter the names.
So the other one is Acinetobacter and then Serratia.
Thank you. There are tasks in healthcare, of course, involving water. We're all aware of that. Some of the ones that we often are involved with our patients and just in our day-to-day activities, cleaning, toileting the patient, and then of course that hand washing and hand hygiene is a big part where you use water. Some actions to reduce risk and kind of implement those infection control practices. Cleaning and disinfection is a huge one. That proper device sterilization. So we mentioned the blood pressure cuffs, the pulse oximeters, central lines, really making sure that every device that you're using is cleaned properly. Hand hygiene is a huge one. We talk about that in every aspect of infection control. So really making sure that we're appropriately doing hand hygiene. And then the use of PPE, or that personal protective equipment. So everything from the gloves, gowns, eye protection, etc. So those are the resources that are available. That's just a brief rundown of one of our posters available. As I mentioned before, it just gives you an oversight of one area where there's a risk in infection control for the healthcare setting. like I said, those are available on our website, that the www.sdprojectfirstline.org. The QR code that we have up here is available for you to scan, and you can utilize that to go to our website also. So now that we've wrapped up the brief education, what we like to do for our office hours is really open it up to an opportunity for you to collaborate back and forth, to ask questions if you have concerns or anything along those lines that might be coming up within your facilities and centered around infection control. So you can go ahead and come off a mute if you would like, if you have a question to ask, or put those questions in chat.
So just one of the things that has come up routinely is how to clean a nebulizer, and we're talking about germs in water and how they proliferate and grow and things like that. So how do we best clean our nebulizers and respiratory equipment? Because that is a common concern across all kinds of facilities.
Absolutely, that's a huge one, and especially when we're in the heightened season of respiratory infections. In the healthcare setting, really you have to be adamant and particular about that process for cleaning your nebulizers, and really have that built into a policy of what is your appropriate and proper process and procedure for this. Nebulizer cleaning is one where in the past, running through tap water through it to clean it out was something that a lot of healthcare professionals did. That is no longer a recommendation. You do not want to use tap water to clean a nebulizer. Best practice in the healthcare setting really is to, if you have to utilize sterile water to clean that nebulizer. With that being said, there's an additional expense. So sometimes it's outweighing if this nebulizer is dirty, do I just toss it and get a new one versus actually cleaning it? For patients or residents that you have on more of that inhaler type device, that is something that does need to be cleaned. That plastic piece that houses the canister, there we go, I was lost my words. That can be taken apart and you can clean for an MDI, clean that plastic piece, making sure to use soap and to thoroughly dry it. You do not want to leave anything wet if you or when you are cleaning respiratory devices like that. You really have to think about it as that mouthpiece is going directly into a patient's mouth. And so it's bypassing one of those barriers or safety nets from introducing those germs to the body. So you really want to pay particular attention to mouthpieces on nebulizers. You want to make sure the other side of nebulizers is that they are dried after use. So opening them up, making sure the excess medication is tapped out, blowing air through it to dry the device thoroughly. And then you got to think about storage too. So what do we do after we've given this nebulizer? Do I just hang it up on the wall next to the flow meter? Do we throw it on the bedside table? Those probably aren't best practices. You never know what's going to come into contact with those. One of the big recommendations I have is they actually make nebulizer bags or some type of storage container where there are some holes so air can circulate through it and allow that device to thoroughly dry while it's being stored.
So is it okay just to air dry them and then put them in your plastic bag or whatever you're going to store them in?
Best would be to have a plastic bag with those holes in it so it can air dry. If you leave it sitting out on a counter or bedside table, you never know what's going to come by that has a germ that's going to slough off or contaminate that device even after you've properly cleaned it.
Because I see that a lot happening where they just put them on a paper towel and turn, the canister upside down and let them air dry.
So that is not the recommended best practice at this point, just because of that reason. And I know it's a practice that's been recognized for a long time. The key with this is no matter what type of facility you're in, is you have to make sure that it's built into your policy and procedure. So what are our steps? What are we deciding is our best practice for our facility? And to make sure that everybody that's giving nebulizers knows what these practices are. Does anybody else have any questions?
Zach or Jordan, where are you guys from, or what kind of facility do you work in, or do you have questions?
Yeah, I work with Delta Dental for the Delta Dental Mobile program, and we're revamping our infection control procedures, trying to make them a little bit more user friendly. Wondering, is there any technical assistance that you guys offer for folks that are doing something like that?
Absolutely. Project First Line allows us to provide infection control training for the dental setting. We've actually just met with a couple different areas of that. We just provided infection control education and guidance for the Dental Hygiene Association. And we are working with the Southeast Tech for their dental assistant program and providing those students education. So if that's something you're interested in, please reach out and we will, or I can drop you an email too. I have your email address from registering today, and we will absolutely work with you to get you what you need.
Awesome, thank you.
Yes. Jordan, any questions?
I don't have any, thank you.
All right, well, thank you guys very much for joining us today. This is kind of the format of our office hours. We do it once a month just to allow for any questions or for things that are coming up within your facilities or needs that you might have, and just to give a brief bit of education. So we will go ahead and wrap up for today. Like I said, thanks for joining us.
The website.
You can, yep, our website's www.southdakota.projectfirstline.org if you are looking for contact information for us. So otherwise, have a great day, guys. Thanks for joining.
Thank you.
Thanks.